Good evening. Let me get this started. So first, good evening and welcome to the University of Evansville's Doctor of Nurse Anesthesia Practice Class of 2025 White Coat Ceremony. Whew, that's a mouthful. Okay. I am Stacy Rutledge, one of these students in the cohort, and on behalf of the class of 2025, I would once again like to welcome and thank all of our family, friends, faculty, and other guests for gracing us with your presence for this occasion. I thought I would begin this welcome speech with Dr. Jones's favorite topic by detailing and honoring the legacy of Florence Nightingale. Just kidding, Dr. Jones. Although Florence is the founder of modern nursing, she is thankfully not the founder of nurse anesthesia. But I would like to share one of my bedside nursing experiences that helped prepare me for this program. It starts back in my bedside nursing days where I received a detailed shift report on my patient. In this particular ICU, the entry walls were glass, and you could see straight in. The lights were on, it was completely bright, every single one. These switches are adjustable for brightness or dimness, and they were on the maximum setting. That might be acceptable for you day walkers, but I was a night shifter and those lights had to go. So upon entering the room, I of course commented on the brightness and asked if it was too bright. My patient said nothing. Okay, that's fine. I then proceeded to adjust the lights and ask if those adjustments were just so much better than before. Well, this patient was blind. Not legally blind, not partially blind, completely blind, since birth. I also received that information in the aforementioned detailed shift report. The patient finally commented, emphasizing the fact that they were in fact blind. Wonderful. I responded, well, I don't feel very bright right now. It was unintentional, but good grief, I still have no idea why I could not shut up about the lights to a blind person. It was an incredibly humbling and humiliating experience. Yet that is ultimately what prepared me for this program, humility. I believe it is what prepared my fellow classmates for this program. Well, probably not offending the blind people part, but the humble part. We were all humbled by leaving our careers and uprooting our lives. We were all humbled by previously being proficient, excellent, or just plain comfortable in our careers, only to become a novice once again, and in adulthood at that. We have been emotionally and financially humbled by this experience. However, none of this would have been possible without all of you. The support, encouragement, and added responsibilities many of you have taken on has been invaluable, and I am certain we do not say it enough, but thank you. The sacrifices you have made on our behalf is greatly appreciated. Next, I would like to share a quote from a doctor. You just have to find that thing that's special about you, that distinguishes you from all the others, and through true talent, hard work, and passion, anything can happen. That's from the great Dr. Dre, in case you forgot about him. However, it does apply to our faculty, who have invested the time and effort to teach us, to guide us, and serve as living proof of the great Dr. Dre's statement. To our faculty, thank you for guiding us. Thank you for sharing your personal experiences, including your triumphs and your own humbling experiences, although I really haven't heard any about a blind person, just saying. It is extremely helpful. Thank you for the support and reminding us that anxiety and nervousness are not signs of trouble. These are just signs that we are about to do something important. Thank you for reminding us that we do not get nervous over meaningless activities. You all have demonstrated humility, which has offered us the realization that our egos are insignificant. Although we often joke that surgeons have a God complex, you emphasize the fact that we are not surgeons or doctors, we are nurses, and we are able to exude a modesty that helps us better understand our place in a larger order with the lives we will soon have in our hands and the impact we can make on their surgery, their recovery, and their overall experience. Everything you have taught us over the past year and a half can be summed up by a quote from Snoop Dogg. The more medicated, the more dedicated. Okay, that might not be the summation of your teaching, but I just really wanted to work in a Snoop Dogg quote. So, As I wrap this up, so our interim dean, Dr. Lampkins, can deliver a much more appropriate and much better speech, I would like to thank you all once again for encouraging us, supporting us, and pushing us to further our nursing careers. I cannot wait to report back in a few months with a growing list of ridiculous things said or done, and be able to provide even more comedic relief. In closing, I would like to make a small request from all of you. Can we please take a moment to say a small prayer for any of the blind souls that I may encounter in my career? Thank you for that. Thank you once again for your time, and on behalf of the class of 2025, welcome to our white coat ceremony. Dr. Lampkin.
Now you can hear me. Should I start over? No, I'm teasing. Thank you for joining us tonight. We appreciate your presence. We appreciate all the support that you have given these 16 incredible students over the years, and we welcome you to our campus. I've been very fortunate to be able to attend more than my fair share of these white coat ceremonies over the years, both for this program and for other health programs that we have on this campus. And every white coat ceremony I attend, I always remember three things really stand out to me in each of those events. The first one is that they never get less special. The pride that's beaming on the faces of the students, the parents, the children, the spouses is palpable, it's powerful, and it's inspiring. It gives all of us true joy to be a part of that and share that with you, and that never gets old. The second thing that always comes to mind for me is trust, and that is the trust that patients have in providers that wear white coats. That trust is an important part of the healthcare process and the way that we deliver care. When they see you in the white coats that you'll wear, they're entrusting their health to you, their livelihood, their future, their relationships, and a lot of their solely important things to you. So, to reciprocate that trust, it's important that whenever you see these white coats in your locker in the morning before your shift, whenever you see the white coat of your sleeve as you're providing care to your patients or using the anesthesia machine, please remember to do the right thing. The right thing is not always the easy thing. The right thing is not always the quick thing or the fast thing or the most financially lucrative thing, but do the right thing because it's the right thing to do. And the third thing that I always remember and comes to me in these white coat ceremonies is that fancy, snazzy University of Evansville logo that you have on these nice white pressed coats. And part of that is because we want the world to see you for all that you are and the excellent training that you've received here and that you really are special. But the real reason those snazzy University of Evansville logos are on your white coats is so you can see that you and us are in this together. We're teammates, we support you, we have faith in you, we have confidence in you. You've received expert training by a dedicated and knowledgeable expert faculty. We have faith in you and we support you. Not only does your program support you, the University of Evansville community supports you, and the greater Evansville community supports you. We want you here. We want you to receive the best training possible and take that care to our neighbors, our families, our loved ones. So when you see that coat, remember, we're all in this together. Thank you, guests, family, loved ones, for coming and celebrating these 16 incredible students and marking an important milestone in their medical careers. Thank you.
Good evening and welcome to the white coat ceremony for the nurse anesthesia class of 2025. Did you think you would get here? No? Thank you, Stacy. Thank you, Dr. Lampkins. And I would also like to welcome Miss Mary Kessler to the stage. Mary is our interim provost here at the University of Evansville, so we're glad to have her here with us tonight. And thank you all for your unwavering support of this program and our students, because as I've told you many times, we cannot do this without you all. Every year at the White Coat Ceremony, and this is our third one, and I look out each time at the bright young men and women who have left their stable jobs and comfort zones to come here to advance their education and careers, and I think there's not a class that can top this one. It's just not going to happen. And I'm going to say that again this year because that's how I feel. I met this group for the first time together in January 2023, and they have simply blown us away. From working together to start a student advisory committee that has enhanced our program and student and faculty relationships in tremendous ways, to the introduction of virtual reality, to peer supplemental instruction to our curriculum, they have shown an incredible desire to grow not only themselves as individuals, but to make sure that everyone knows who we are here at the University of Evansville. I'm so excited to see what you all accomplish over the next year and a half as you represent us in Evansville and out in the tri-state area. This is the time to really dig in and remember that while you've accomplished so much already, the most challenging aspect of the program is about to begin. This is the time when we have to watch you leave the nest and put into practice and action everything you have learned thus far. But I have no doubt that you will continue to make us proud, and that this next part of the journey will be a staunch reminder of why you chose to pursue the best career in healthcare. To the family and friends joining us today, we all say thank you. Thank you for your supporting these students and for understanding that, just as I said on their orientation day, they have to fit life into anesthesia school, not the other way around. It won't work to try to fit anesthesia school into life. This has become their full-time job, but they're almost halfway through. Hang in there. We know that you're walking this road with them and experiencing it in a totally different way than they are. Students, be patient with your families and your friends. They miss you, and they are just as eager for you to finish this program as you are. And to my family, I'm so grateful for the support that I receive every day as I strive to make this the strongest program in the Midwest. I have lofty goals, and I won't give up until I reach them. So to my personal team, I love and adore you all, and I thank you all for standing by me. Sitting behind me right now are some of the most caring and compassionate individuals I've ever had the privilege of working alongside. I'm convinced that anyone in nurse anesthesia academia would be hard-pressed to find a team of CRNA faculty who are better than what we have right here on this stage. Dr. Matthew Harmon is the program's assistant director. He is constantly working, creating, and thinking of new ways to make this program stronger for our current and future students. Dr. Darlena Jones is one of our esteemed assistant professors, and she teaches in multiple classes and leads the senior seminar review courses to prepare our graduates for the national certifying exam. She has been a dear friend and mentor to me for many years. Dr. Alexander Nagorne joined our team in August as an assistant professor and is already earning the respect of our students as he lectures and leads labs, sharing his personal experiences along the way. As the saying goes, good leaders are only as good as the individuals with whom they surround themselves, and there's no way that I could do what I do every day without this incredible team. Our program is successful because of you all. We also owe a huge debt of gratitude to Ms. Missy Holtzmeyer, the program's operations administrator, and Ms. Trenda Ridge, who just started with us this week as our administrative assistant and jumped right in to help make tonight's ceremony a success. Missy and Trenda truly are the eyes and ears of this program, helping manage the budget, the difficult day-to-day tasks, and even steaming white coats this week, so that we as faculty can focus on educating our students. So can we please give our faculty and staff a hand for all they do for us? I didn't forget about Wes, but I had to save him for last. Wes Oliver is our clinical director, and he works tirelessly to help secure additional clinical sites for the program and maintaining the students' clinical rotation schedule once they begin residency. The respect he has earned from students led them to invite him to be this evening's keynote speaker. Wes began his career in nursing as an LPN in 2010 and later went on to receive his Associate of Science in Nursing from Excelsior College in 2012 and a Bachelor of Science in Nursing from the University of Arkansas in 2018. He's worked in various nursing disciplines such as emergency medicine, critical care, pediatrics, and flight nursing. He received his Master of Science in Nursing from the University of Tennessee at Chattanooga in 2021. Wes has been married for 12 years and has 2 children, and we're so glad that Laura and the kids could be here with us tonight. They live in Bowling Green, and Wes works for the medical center. The contributions he has made to UE Nurse Anesthesia thus far have been phenomenal. I am personally grateful for the work he does every day to ensure that our students get the clinical experiences required to graduate, and for spending his own time on campus leading additional labs and offering personal anesthesia experiences to enhance their learning. Mr. Oliver, it is my honor to welcome you to the podium.
Good evening, ladies and gentlemen, esteemed faculty, and to the University of Evansville Nurse Anesthesia class of 2025. It is great to be here, but to be honest, I was very surprised at the opportunity that I was given to be the keynote speaker for this white class ceremony. You see, I just finished with about 2 sim lab sessions, grilling these students, breaking them down, trying to build them back up. So I do think it speaks highly of them that they would still consider me for this opportunity. Nonetheless, I'm thankful. When I consider what to say and how to approach this, I thought maybe I should try to conform my speech to the people in the class and somehow try to reach each one of you. I thought about adding the good time vibes of Mariah, the social prowess of Carly, the hard work of Mackenzie, the easygoing attitude of Joseph, the introspection of Lucas, the maybe she's a genius, I don't know. The genuineness of Sarah, the stoic poise of Casey, the kindness of Catherine, the advocacy of Stacy, the conscientiousness of Dominic, Brad, just being Brad in a good way, the inquisitiveness of Rachel, the artistic nature of Natasha, the altruism of David, the amicableness of Franny, and even the striking thoughtfulness of Madison. Just having to come up with these adjectives was hard, so I thought maybe I shouldn't do that, but I had to have some help with those adjectives, so thank you, Madison, for finishing the list with me. So I'll just live vicariously through Frank Sinatra, and I'll do this my way. I want to thank everyone for being here, for the support for these fine, upstanding students tonight. Your presence says volumes about the support and the love that you have for them. I think it's important that we acknowledge you and that we lift you up. Your friends and loved ones within the next month and a half will embark on a clinical journey that few people in this world have the opportunity to traverse. It is crucial to know this path is not for the faint of heart, but that every one of them is pursuing this to give you a blessing in some way. Whether it be husbands or wives supporting each other, fathers or mothers supporting their children, or children supporting and showing the value of the investment you, the parents, have put into them. Please remember the blessing they are trying to give you. Because there will undoubtedly be a time when they are at the breaking point and they will call you and need encouragement. They will react poorly to you in a moment of weakness, or they will shut down under the immense weight, stress of the moment. You hold such an important role on this journey. If I may offer some advice to both the supporters and the students. When these times happen, be slow to speak, quick to forgive, and abundant in compassion. There are a few that understand the rigors of a clinical load and academic requirements such as anesthesia school. Keep in mind from this moment forward, you have only about 19 months. And while that may seem like a long time to be away from your loved one or stressed with your loved one, know that the days are long, but the months are short. It will come much faster than you realize. So to the University of Evansville Nurse Anesthesia class of 2025, I say this. So you want to be a CRNA? May the odds be ever in your favor. In the next month and a half, you will enter a whole new chapter of your education as an anesthesia provider. One of the most valuable points of wisdom that was ever given to me in my career was this phrase: every day is an interview. You will walk into a very small world of anesthesia providers that is built on relationships, competence, and professionalism. Every day you will have many interactions with your future peers, and each one of them will be an interview. While this may not always be fair, it is so accurate. You represent yourself, you represent your future opportunities, and you represent the University of Evansville. For the sake of all these, please, please, please act accordingly. This is not a mere job that you are doing. You are working in the role of an esteemed, highly esteemed profession. This means showing up on time, communicating effectively, being trustworthy, showing confidence in managing complex situations, and so much more. The future of the nurse anesthesia profession is so bright, and I want nothing more for you than to excel in all of its brightness. 3 to 4 months from now, you will have been in the OR for a little while. You'll be giving some of the white stuff. You'll be turning on and off some of the yellow stuff. And you'll be intubating somebody while you yourself are having an episode of SVT. And while you'll be learning new things every day, the newness will not quite be as acute as it was when you started clinicals. Your alarm will go off at 4:45 or 5 a.m., and you know that you'll need to be at clinicals by a certain time, and the mind will be willing, but the body will be weak. It is in those moments that I highly encourage you to know your why. Knowing your why is different for every one of us. For me, knowing my why was being able to bless my wife and bless my children. Maybe for you, knowing your why is the opportunity to go back where you've come from, the opportunity to go back home. Maybe it's the opportunity to live a life that you could never have before becoming a CRNA. The opportunity to be on a mission trip somewhere across the world with a greater goal than monetary value. Knowing your why is, in effect, going back to your purpose. What is your why? Why is your why? And is your why strong enough to keep you moving forward despite all the incredible opposition you may face from this day? You will encounter complex patients, and their comorbidities will be so diffuse that you'll be scratching your head on how to give anesthesia to this patient. Know your why. You will encounter preceptors that are less than gracious and highly critical, pushing you mentally and emotionally into seemingly unattainable success, where you have to adapt and you have to overcome. Know your why. You will encounter various staff at hospitals that, for reasons unbeknownst to you or anybody else, will feel as though they can talk to you however they wish. Be gracious and know your why. You will come home physically and mentally exhausted. Your brain will hurt because of all you have learned that day and the hard work you've done that day, only to have to study for the upcoming test a couple days from then. Know your why. Stress, a lack of sleep, poor eating habits, inability to be physically active, time away from family, and the very high expectations of all these things that you will experience during this season of life. And that's what it is. This is a season, meaning it has a beginning and that it has an end. Seasons are often filled with blessings of the harvest and challenges during times of famine. Will you choose to see the bounty of harvest during this time? Will you have perspective on the newfound friendships? Will you choose to learn and grow at the new opportunities that are afforded to you? Will you appreciate the beauty of what has taken you to get to this moment? Ask good questions. Look for new challenges. Stay humble. Stay hungry. Take advantage and reap a full harvest during this season. However, times of famine, they always come. It's okay to struggle, and it's okay to talk about it. Mistakes will come. Give grace to others and give grace to yourself. Find someone who's going down the path with you to talk with, or find someone who's gone down the path before you that you can confide in. And I encourage you not to merely engage in positive self-talk, but be accurate in the way that you talk to yourself. Be accurate in the way that you see yourself. Times of famine are hard on us all. Do not walk the path alone. Do not believe the lie that no one understands. And do not be afraid to ask for help. You are filled with a room of people that support you, and you are facing a faculty that wants nothing more than to see you be successful, personally and professionally. Class of 2025, you trained for the past year and 3 months for what is coming. I love the phrase the U.S. Navy SEALs say, under pressure, you don't rise to the occasion. You sink to the level of your training. That's why we train so hard. Fall back on your training both as a nurse and what you've received in anesthesia school. This season of training is truly a marathon. Don't be consumed by who's running faster or who's running slower. Focus on your ability to run with endurance. While the remaining time you have left in your education is spent focused on trying to pass one test. Your studying does not consist only in passing the test. Plug for Dr. Fitch, you better pass the test. However, it is for the day in what you know and how you have trained stands between your patient and the grave. So train and study with diligence and determination. It has surely been my honor to stand before you tonight. Please remember several things. This night and all these people cheering you on. The advice I gave you about how to interact with your loved ones during hard times. To always, always know your why. And to take full advantage of what this season has to offer you. I want you to know, I believe in you. And I'm not the only person in this room who does. Now is the time for you all to believe in yourself. Thank you.
If you all, class, would please stand, and when you hear Dr. Jones or Dr. Nagorne say your name, would you please come forward and bring your white coat to me?
Casey Anderson. David F.A. Sarah Cronin. Natasha Emmerich. Carly Hill. Mackenzie Mahan. Brad Markham. Madison Markham.
Catherine Newcomer. Lucas Nunes. Dominique Pomo. Stacy Rutledge. Rachel So. Joseph Schutte. Mariah Spade. Franny Tenery. Stay standing. If you notice on the back of your programs, there's the nurse anesthesia oath. We're going to have the class of 2025 take this oath in front of their family, their friends, and their faculty members. So this will be a public display of the dedication, of the determination that you have moving forward and we are going to hold you to it. All right. So I'll read first, and then you're going to repeat after me. As a student of the University of Evansville program of nurse anesthesia, I solemnly pledge to uphold the university's mission and vision. Including thinking critically, acting bravely, serving responsibly, and living meaningfully in a changing world. I will uphold the American Association of Nurse Anesthetists Code of Ethics. Centering my actions around my responsibility to my patients. Responsibility as a professional and responsibility as a leader. I accept my duties as a role model, educator, and lifelong scholar to further the profession and promote patient-centered care. With this pledge, I accept the duties and responsibilities that embody the nurse anesthesia profession. I take this oath voluntarily and confidently with full realization of the responsibility in which I am entrusted. Congratulations, you have your white coats. You've now officially finished the didactic part of your education. Thank you all for attending. And if you would please join us afterwards downstairs, we have some punch and refreshments and of course quality time with the class of 2025.